Moving on, Bangladesh's worst dengue outbreak has crossed the 1,000 mark this year alone, where the number in itself is higher than the number of deaths the country has reported since 2000 combined. The World Health Organization has warned that diseases like dengue, chikungunya, and even the Zika virus will be on the rise owing to climate change. Here's the story.
It's turned into the biggest health emergency Bangladesh has seen in decades. Hospitals burst at the seams with the patient influx. And this even after public hospitals have added hundreds of beds. The numbers have gone through the roof this year. The dengue death toll in 2023 hit 1,017 as of the 2nd of October. Among the dead are 112 children under 15, including infants. Nearly 209,000 people have been infected this year. Life's a daily battle.
একজন বমি করছে আর হলো পাতলা পায়খানা হয়েছে হওয়ার পরে ব্যাপার হলো কি আমরা
We came to the hospital as she was having vomiting and diarrhea for one day and she was diagnosed with dengue. Her blood platelet was 14,000 at first, then it was 18,000, then 39,000, then 60,000 and now it is at 81,000. The doctor advised some tests as they have found some problems in her liver and water in her lungs. The doctors assured us that dengue caused the water in her lungs and that she would recover from it. They suggested 4 more tests and we are doing these.
The new figures dwarf the previous highest total from 2022 when 281 deaths were recorded for the full year. Doctors say there are many patients coming in with repeat cases, people who've tested positive for dengue for the 2nd, 3rd or even 4th time. The severity and death rate is also higher for such cases. Delay in treatment, deliberate or due to shortage of facilities, also pushes up the death rate. The World Health Organization has pointed at the root cause for the unprecedented surge being climate change factors. Rising temperatures are stated as reasons for faster and wider penetration of mosquito-borne diseases.
ডেঙ্গু যে শুধুমাত্র বাংলাদেশে হচ্ছে ব্যাপারটি এরকম নয়।
It's not happening only in Bangladesh. Many tropical and subtropical countries are experiencing dengue this year. It has a relation with global climate change. The growth and development of the Aedes mosquito requires a suitable and optimum temperature. It requires an optimum temperature for the multiplication of the virus. The global climate change is playing a role here in providing this temperature level.
টেম্পারেচারটা গ্লোবাল ক্লাইমেট চেঞ্জের কারণে অথবা তাপমাত্রা বৃদ্ধির কারণে সেটি উপযোগী একটি তাপমাত্রা উপযোগী আর্দ্রতা পেয়ে যাচ্ছে।
The government has launched a series of awareness campaigns, now an annual effort that picks up with the rainy season when the threat is at its worst. Encouraging use of mosquito nets, reducing water accumulation and stagnation around homes and public venues. The annual spread of dengue in Bangladesh and several countries in South Asia has highlighted the need for prioritized and electronic-based surveillance and targeted interventions. The numbers themselves, the new casualty records, spell out that the region can ill afford the neglect. Wiping out mosquito larvae are big focus areas.